Hi, faculty and students of Bio 476. My name is Riley Lonergan, and for my lab presentation, I will be doing the lower limb, focusing on the leg and foot. First, I want to give you an outline of our lecture. First, we will be going over the compartment organization and bones. We're going to orient ourselves with the bones of the lower leg and what makes up each compartment. Next, we will be looking at muscle illustrations. I made a video of me drawing the muscles of each compartment, so I think this will be a simplified and organized way to go about each compartment. And finally, I made clinical correlations where we will use medical diagnoses relevant to these terms and relate them to clinical situations. So first, we're going to look at the bones and compartment organization. So right here we have our tibia and fibula. The tibia is this long, thicker bone right here. This is the anterior view when you're looking at it straight on. And then this is the posterior view when you're looking at it from behind. And then this smaller bone right here, that's the fibula. And it's right here from the back. They're both connected through the interosseous membrane, if you could kind of see it right there. Our tibia has an important structure on the bottom of it called the medial malleolus, and that's it from both angles. This part makes up part of the ankle, and so does your lateral malleolus, which is on the sides of the ends of your fibula. Then up top on your fibula, another important structure is the head. Next, we're going to talk about bones of the foot. Our foot has three main sections. We have our phalanges, then we have our metatarsals, and our tarsals. So our phalanges themselves have three parts. Most farthest away from the body, we have our distal portion in digits 1 through 5. Next, we have our intermediate, which is only in digits 2 through 5. And then we have our proximal phalanges, which is closest to the body throughout each digit. Then we have our metatarsals, which is this long bone right here, and our tarsals are all these bones right in here that we will talk about very soon. Move myself up again. So here are key terms to our left. First, we're gonna talk about our tarsals. So our tarsals have these different bones in them. First, we're gonna talk about our cuneiforms. Our cuneiforms have three different names. So we have our medial cuneiform, which is closest to the midline of our body. And then we have our intermediate, which is in the middle of our medial, and then our lateral cuneiform right here. So we have medial, intermediate, and lateral. Excuse me. Right below that, we have our navicular bone, which is kind of shaped like a little boat right there. Then right next to our lateral cuneiform and our navicular, we have our cuboid bone, which is kind of in the shape of a cube. And then from the superior view of the right foot, you can see our talus from this angle, and then our heel, otherwise known as the calcaneus. So if you're like me, mnemonics and different little things help me memorize all these small bones especially, and if you need any help remembering, I may be able to help you. So we're going to talk about three main components of the tarsals. Even though there's a little bit more, I generally know the calcaneus and the talus. I feel like they're big and easy to remember. So first, what helps me is if I think of navicular, it helps me to think of navigating. So here's the navicular, and if you spin it around the opposite way, it kind of looks like a boat. So if you think about it, you need a boat to travel, and you need to navigate when you travel. Secondly, we have our cuneiforms. I don't know why, but to me, it kind of sounds like cute little forms. So when I think of cute little forms, there they are right there. There's 1, 2, 3 cute little forms. I think of cute little things, like we could think of cats. So here's 3 little cats all in the middle, and they're cute little forms, cute little animals. And lastly, we're going to talk about the cuboid, which I said in the last slide that reminds me kind of a cube because it does look like a cube. So there's the cube, and that's what I think of when I think of cuboid. So that's what helps me. Obviously, it's not going to work for everyone, but I figured I'd give you some tips to help you out. So here is a lateral view of our right foot. These are some of the same terms as last time. So we have this view of the medial cuneiform. Then we have a completely different view of the navicular, which it doesn't look so much as like a boat anymore. Then we have the talus and our calcaneus one more time. So now we're going to go over the compartments of the leg. Here's a list of our anterior, posterior, and lateral compartments. I'm not going to read them all because I'm going to show you them on our next slides. So first, we have an anterior view for our anterior compartment. In each, let me move my head. Sorry about that. So if we look, here are the arteries and nerves, and then we have the muscles. So let's start with the muscles. So this long muscle that goes right above the tibia, and it's one, if you flex your feet, it is one of the muscles for me that pops right out, right by my tibia, and that's called our tibialis anterior. Then deep to that, we have our extensor digitorum longus, and that connects to digits 2 through 5. And then extensor hallucis longus comes even deeper from that, and that is used to flex our hallucis, which is another name for our big toe. Then throughout all those muscles, we have our anterior tibial artery, which you could see is that red string that goes right in front of the leg. Right next to this that you can't see is the anterior tibial vein, but that runs right along the side of it. Then we have our deep fibular nerve, which is right in there, the yellow. So now we're going to talk about our posterior compartment. So for the muscles, most superficially, which means closest to the surface of the skin, is our gastrocnemius. As you can see, it's this large muscle that people may just confuse as the only calf muscle because it's the one that you could see the most when you go on your tippy toes or you try to flex it. So this is it. It has two heads connecting that long tendon. Then if we peeled this back, we have our popliteus, which is this muscle that is right behind, or in other words, deep to our plantaris. And our plantaris is a small muscle right here, but has this very long tendon that connects all the way down to our heel. And finally, we have this structure right here that's called our soleus. And I remember seeing this part in lab, and it reminded me of a scaly fish because it has this big shiny tendon connected to it. Then even deeper to that, we have our flexor digitorum longus, which comes down and connects to our digits. Flexor hallucis longus, which come down and connects to our big toe, our hallucis. Excuse me. And then even deeper to that, we have our tibialis posterior. Now we have the neurovasculature left for our posterior compartment. This is a little bit easier to see. So we have the fibular artery, which is that red line that comes down right there. And another time you can't see the vein is for the fibular vein, which is also right next to that. Then we have our posterior tibial artery, which is that red one that comes all the way down there. Also in this section is the posterior tibial vein, which is that blue one. And then we have the tibial nerve, which is the yellow that runs down there along with them as well. Then finally, we have our lateral compartment when we only focus on 3 different things. So first, our muscle is our fibularis longus, is this one right here with the large tendon on it. It kind of comes right there. And then we have our common fibular artery, which is right up top here, and then that splits off into our deep fibular artery, but we're focusing on mainly the superficial fibular artery. So now that we are familiar with all the compartment, muscles, neurovasculature, and the bones as well, we're going to look at this video illustration that I made. I hope you like it. So we're going to orient ourselves, our left and our right. This is the anterior view. That is our patella that I tried our best to orient ourselves. Then we have our tibialis anterior. We have our extensor digitorum longus and our extensor hallucis longus. And they're all color-coded. Okay, next we're going to orient ourselves again. Now we're looking at a posterior view, and that is my best drawing of the gastrocnemius. So we're going to go in our posterior compartments from very superficial to deep. Same view again. We're going to look at our right leg now. So I drew the popliteal and the plantaris as well as the soleus. So that's the soleus. That's the plantaris, and then that's the popliteus. You can't forget about that long ligament attached to the plantaris. Finally, even deeper to that, we have a few muscles left in the same view. We have our flexor digitorum longus, our tibialis posterior, and our flexor hallucis longus. Finally, we have our lateral compartment. So this is a lateral view of our foot. I oriented ourselves with the gastrocnemius in the back, and then right in the middle there is our fibularis longus. So that's the end of the video. I hope that helped you out. I know it did when I drew it, so maybe you could do something like that similar for yourself to work on your orientation of the muscles in the body. So finally, we have our clinical correlations. First one that I thought was interesting when talking about these compartments of the legs is shin splints. Shin splints are also known as medial tibial stress syndrome. It could affect your tibialis anterior as well as your tibialis posterior. It depends where your shin splints and pain is located. This medical issue can be caused by increased intensity of workouts or having flat feet or arches. It is very common in runners, athletes, runners, dancers, and military. The best treatment that could be given for this right now is taking rest, taking time off of your regimens of exercise, icing when needed, and using anti-inflammatory medications. And lastly, I'm going to talk about foot drop. Foot drop is a clinical sign indicating the paralysis of muscles in the anterior compartments of the leg. So basically, it is caused by damage to the fibular nerve, which we just talked about, the common fibular nerve, sorry. The anterior compartment muscles are just completely paralyzed. So then there is no opposing movement or contraction to the posterior compartment. So your foot is permanently in plantar flexion. And then a lot of people who have this syndrome have to have a limp. So in order for them to walk a little bit more normally, they do what is called an eversion flick. And this one, a patient flicks out their foot like this when they walk, so then they could get that flex motion to continue the gait cycle. So that's all I have for you today. If you have any questions, feel free to reach me at my email. It is listed below. And here are some of my works cited. Thank you very much.